When we think about whether a group is large or small in terms of PPACA, the principal reason we're doing so is to determine whether a group is eligible for a penalty or not. And knowing how to count and determine whether you are a large or small group is critical, because PPACA is sort of like being pulled over for a traffic ticket by a highway policeman. You run through a stop sign, or maybe you do one of those California rolls right through the stop sign, and as soon as you clear the intersection, you see the policeman's car and the light on it, and you know you could be getting a ticket. Now occasionally someone, not me, but someone else with a little more charm might be able to talk the cop out of the ticket. With my luck, after he pulls me over, he'll check my license plate, and he might see that even though I've paid my license fee for the year, perhaps I have not put the little square sticker, the little colored sticker that goes in the upper right-hand corner of my license tag here. Now he's got me for cruising through a stop sign and not having the proper sticker on my license. As he gets out, he might notice that I have a cracked tail light on the rear driver's side. At that point, I'm eligible for 3 tickets: the cracked tail light, the failure to put the sticker on my license tag, and cruising through the stop sign. He could give me all 3. He could give me a fix-it ticket and let me go off with a warning. It's possible that maybe I get extremely lucky and just as he's about to talk to me, a terrible bank robbery is occurring, and he jumps back in his car and threatens that he knows where I live and I should never do that again, and I get away with no ticket. Well, that's a good analogy when you think about PPACA, because if you can avoid the very first step in that sequence I described, in other words, I run through the stop sign but I have no cop sitting there, that's sort of like in PPACA making sure you're not a large group, because the moment you become small group in 2013, you get to keep that status in 2014, and that means you're not eligible for any tickets. As a small group, you can do anything. You can give benefits that are not affordable, give benefits that don't meet the minimum PPACA requirements. There may be some consequences to your employees, but not to the employer. If you're a small group, you're off the hook no matter what. So figuring out how to count and using all the rules we have available to us to try to become a small group keeps us out of being eligible for a PPACA penalty for not offering the right kind of health insurance to our employees. And as we mentioned in our prior presentations, which you'll find on this website, if you are a large group and you are eligible for penalties, the end game, of course, is going to be, did one of your employees get a premium tax credit from the state exchange? Knowing how to count is important because PPACA requires you, if you are a group of 50 or more full-time equivalents, to play or pay. Play means to offer the right kind of health insurance to your employees. Pay means to pay the penalty of $2,000 or $3,000 per year, depending upon how the penalty is calculated. But if you note the term, large group is 50 or more full-time equivalents. It's not just 50 full-time people. That's why I can sometimes give a presentation to a Chamber of Commerce meeting, and someone will ask me that, for example, that he has only 20 full-time people in a couple of fast food restaurants. Well, 20 full-time people could equate to 50 full-time equivalents, depending upon his part-time and seasonals and how they're counted. That's what this course is all about, to teach us how to do those counts. Not only how to count, but when to count, because those two considerations go hand in hand. Keep in mind that in our counting for our groups, we have a safe harbor of what's known as the larger of 5 bodies, or 5%. Meaning, if I have 100 people and I do everything right for 95 of them and miscount 5 of the 100, I'm miscounting 5 or 5% of the bodies I have. The rule lets me choose the greater of them. So if I have 60 people and I miscount, and it's possible to miscount because this gets pretty complex, If I miscount, I would have 5% or 3 bodies, or as the rule says, 5 bodies in period, and I get the larger of the two. So with 60 people, I could miscount 5 entire bodies. This safe harbor assumes, of course, if I'm a large group, that I provided appropriate group health insurance or I pay a penalty. We're going to refresh your memory as to what appropriate group health insurance, and as I'm refreshing your memory about what is appropriate group health insurance, keep in mind that you can go back to our earlier webinars for more details on this issue. However, I want to caution you about one thing in this presentation. We talk about a number of safe harbors. Safe harbors are just a way for the government to basically describe a rule that they know is very complex and perhaps not particularly well thought out at the moment. So they get it in the field and see how people handle it, and they basically say, your safe harbor is you can make mistakes here or there and be okay. But in all the circumstances, a safe harbor is a reliance on a good faith effort. So if I'm using a larger 5 or 5% exception, and I was to tell my human resource people, for example, I have a 1,000 life company and I hire 50 people a year, to go ahead and intentionally miscount or misapply the rules to the first 50 people I hire. Well, that would not be a good faith effort in terms of the safe harbor of 5 or 5%. And in order to make sure that an employer does his best faith effort, the Department of Labor has announced that they will have a whistleblower protection program for employees who identify employers who are misusing the PPACA Act. Their description of their protection of those employees was that they would protect them as much as they did the whistleblowers who worked with them on Enron and companies of that nature. So as a broker, I would not advise you using safe harbor rules, any of the ones discussed in this hour presentation or in other presentations. Do not use the safe harbor rules cavalier. Do your best faith effort to work within the rules, and everything should be fine. Defining appropriate group coverage is where it starts. If it turns out that in your accounting you are a large group, 50 or full-time equivalent, then your obligation under PPACA is to provide qualified employees a level of coverage which is defined as a minimum level of coverage under PPACA. That minimum level coverage has a few definitions, and we generally clump them all together with the word appropriate. First off, appropriate means the policy has to meet minimum essential benefits. Minimum essential benefits is going to differ from state to state. In California, we'll talk about what minimum essential benefits are in a moment. But what the minimum essential benefits is getting at is simply saying that an employer can't say, I've offered a group health insurance plan. It doesn't cover everything and it's $1 million deductible, but nonetheless I've offered the group health insurance plan. PPACA basically says that it will define what is group health insurance. So if you drop below these minimum essential benefits, or you drop below the minimum metal value levels, that's simply declared as not having group health insurance. We'll get back to the definition of minimum essential benefits in a minute. But along with that, the appropriate group coverage has to meet a certain level of coverage. In this case, the level of coverage is bronze. Bronze, as you've heard about in other presentations, means 60% coverage of a typical actuarial average value of a claim. Also, in terms of appropriate benefits, along with essential benefits and bronze level coverage, an employer cannot request that his employee pay any more than 9.5% of last year's W-2 Box 1 reported income. So if an employer has an employee making only $12,000 a year and is asking that person to contribute $100 a month for his individual coverage, that would be $1,200 in a year, 10%, and that would be deemed non-affordable coverage, and the employer would be subject to penalty. Keep in mind that this affordability test is a mathematical one. It's not what the employee thinks. It's 9.5% of the W-2 Box 1 last year. If it's a new hire, it's his assumed annual income. And that is for individual coverage. A lot of people get confused because they've heard that PPACA requires an employer to offer dependent coverage. Two things to keep in mind on that rule. One, dependent coverage under PPACA refers to children only, not the spouse. Two, offering dependent coverage does not mean that the employer has to pay for it or any part of it. So a policy that charges an employee, single employee, for minimum essential benefit coverage at the bronze level and charges him no more than 9.5% of the individual policy, that would be appropriate coverage, and the employer could require that person to pay 100% of the dependent coverage if that's what the employee wanted to do. Affordability, when we measure it when someone goes to the exchange, is an entirely different test, so don't get confused. When a single individual, whether employed or not, goes to the exchange, affordability is going to be based upon his household income, not his W-2 as an individual income, and it's going to be based upon the silver level of coverage, and it's not going to be 9.5, but rather it's going to be on a sliding scale based upon his income. Go back to our webinar on preparing for 2014 Part 1 in order to learn more about this topic. But before we leave it, let's just take a real quick look at what we call the bronze level coverage and minimum essential benefits. In California, essential benefits has been defined as contract language that's compliant with the Kaiser 30-1500 plan. Now, when we say compliant, it doesn't mean the language has to be identical. It simply has to be generally consistent with the Kaiser policy. And the Kaiser policy, when it refers to the $30 office copayment or the $1,500 deductible, that numerical value, 30 and 1,500, is a descriptor of a metal level, bronze, silver, gold, platinum, whatever it may be. Essential benefits is only describing the contract language itself, not the dollar values that it may have connected to it. The dollar values are calculated entirely separately with a different calculator, which again you can find back on our webinar, Preparing for 2014 Part 1. The essential benefits also requires an employer to have a policy that offers pediatric vision benefit and pediatric dental benefit consistent or compliant with the policy language in those two plans here in California. The four standard levels of coverage, as we've already talked about, is bronze, gold, silver, and platinum, and bronze represents 60%. Now, with that in mind, does your employer group have to offer the essential benefits, bronze level, no more than 9.5% to his individual employees? The answer is he only has to do that if he's a large group. We've pulled up on the screen for you a very simplified calculation that I want to walk you through as a starting point. We'll get more complicated as we go along. What we're simply asking is, how do we count people and what's the size of my group? And the first thing we have to answer on how we count people is seen in the footnotes, or the asterisks at the bottom of the chart. PPACA describes only three types of employees: full-time, seasonal, and variable hour, or what we would call part-time. People get very confused because employers will say something like, I have a 1099 employee, or I have temporary employees, or I have contracted employees, or I have leased employees, etc. PPACA doesn't care about any of those definitions that an employer may use. PPACA requires all employees, no matter what the employer may call them, to be classed into three categories: full, seasonal, variable hour, or what we call part-time. It starts obviously with where is the employee recorded for his quarterly taxes and wages. Here in California we call that the DE9C. So if I have union employees and they are on the DE9C of the union, I'm not going to have to count them because they belong to the union for the union's count. But if I have employees that I carry on my DE9C and I happen to have a union agreement to pay them union wages and union benefits, I might even buy the benefits from the union. But if they're on my DE9C, they are my employees for my account. Same thing with PEO or leased. If the PEO has me running my own quarterly tax and wage statement, and I'm simply using the PEO to purchase health benefits or other kinds of benefits, perhaps even do my payroll for me. If they're on my DE9C, they count for me. Rather obviously, PPACA doesn't recognize something known as a 1099 employee. If the person is truly a 1099, that person is responsible for his own coverage. If the person is an employee and is simply being paid under the table improperly, you've got a problem on your hand, and eventually PPACA, if they catch that, it's going to say, no, that's your employee. So what are the three definitions of full-time, seasonal, and variable hour? It starts with the concept of the rate of work per week. The definition is a person working at the rate of 30 hours per week or 130 hours a month for 120 days or more in the year is a full-time employee. Let's go over that again. I have somebody working 20 hours every other week and 40 hours every other week. If you do your math, you're going to discover that that person is working at the rate of 30 hours a week on average. Also, if you look at the number of days he works, 20, 21, 22, depending on which the month is, you'll see that he's averaged 130 hours. When the person arrives at his 120th day of work for the year, he is classified full-time. Now, a lot of people at this point say, well, I just hired somebody last week. How do I know whether they're going to make the 120 hours or not? Well, we'll get into that when we talk about new hires. But for our purposes of accounting, we do know whether the person worked 120 hours for the last 120 days for the last year, because we're going to pick at the point in time and go backwards and count his payroll records. As we count the number of days he works, even though we may have hired him for seasonal work, by PPACA, for the purposes of group calculation, when he hit that 120th day, he morphed or magically became a full-time employee no matter what I called him. So, for example, it's the end of the year and I'm looking back and I'd hired 10 people the 1st of January because I'm a ski resort. I only expected them to work 90 days, January, February, March, and then assumed the snow would be melted. Well, this particular last winter, as I looked backwards, I discovered that they stayed the 4th month because the snow hung around and I kept them on the rolls. That means they hit their 120th day sometime in that 4th month. And for the purposes of my group calculation, I have to include them as a full-time employee and calculate them into my group size. In order not to get ahead of ourselves, you might be saying to yourself, yes, but I hired them back in January, February, March, and April. Now I'm doing my count at the end of 2013. They're not even on the rolls anymore, and they're not even eligible for insurance coverage. This counting of employees has nothing to do with eligibilities of employees for coverage at this point. You're correct. They're no longer around, but they were part of your group for the period that you're counting, and so they have to be counted. Well, what if someone had not made the 120 days? They worked full-time but didn't make it. PPACA calls that person seasonal. So let's say for fun, I'm a bookstore at a college, and I looked back at the end of 2013, and I found that I hired somebody on a full-time basis, but just for the month of January as the winter session started at my college. So he worked 30 days. I hired him for a 30-day period at the start of the summer session, just as the summer period was beginning. Then I hired him for 30 days, full-time again, the start of the fall semester. He's now got 90 days, and I suddenly discovered that during the Christmas season I also hired him, and his 120th day, when he hit it in December, he became, for the purposes of my group count, a full-time employee. The 120 days do not have to be contiguous. In fact, someone could work for me every 3rd day of the year. And if you do your math, you'll realize that person became a full-time person. So, full-time is someone working at the rate of 30 hours a week or 130 a month at a full-time basis for 120 days or more. And seasonal is the same definition but for less than 120 days. when I look back and do my count. Everybody else falls in as part-time people. And what PPACA is going to want us to do is to add up all the hours of all the people that weren't working full-time and divide them through by 120 hours a month. I recognize that's the same number as the 120 days a year, but don't get too confused. What we're looking to do under PPACA is determine full-time equivalents. And part-timers are all massed together and divided by 120 to determine how many full-time equivalents I have. So for example, I have 60 people in the month who each work only 2 hours. Well, if you do your math, that's going to be 120 hours of variable hour employees, and when I divide by 120, I get one full-time equivalent. And with that analysis, you can see how someone could have a group of 20 full-time people and still end up with a large group. Let's go through and do a mathematical example. As you can see from the slide that just changed, this sample company has very few part-timers, but nearly 50 full-time people. 40 full-time, 20 part-time, and each part-timer does 10 hours per week. To make the math simple, in reality, we'd have to go back and count every day of every month and every week of every person. But for our purposes, we're going to pretend that every part-timer works the same number of hours and that there are only 4 weeks in the month. We're not going to worry about the 21st or 22nd day of work each month. If we go through the calculation, we put in A, the number of full-time employees in the year. And from the title, we know that to be 40. What we did was we stood on the last day of the year, hypothetically, looked backwards for 12 months, and realized that every month we had on average 40 full-time people. Some months we had 38, some months 42, but when we totaled up all 12 months and divided, we had 40 on average. The total hours worked by each part-timer, since each part-timer worked 10 hours a week, and we've hypothetically said that there's only 4 weeks in each month, exactly 4 weeks, each part-timer worked 40 hours. The number of part-timers I used in B is 20. So the total number of part-time hours I had would be 40 times 20, or 800. PPACA requires us to divide by 120, as you see in the chart, which gives us a number of 6.66, which in this case will be rounded off in the parentheses to 6. Some of you may have taken earlier courses that saw the rounding up went up to 7. This has been changed. The regulatory rule right now is you don't get to the next full-time body until you get completely there. So even if that number was 6.999999, it would still round down to 6. You get to 7 when you get to 7. In this case, we have 6 full-time equivalents, which we have to add to our 40 full-time people. And so this group is a group of 46. If we go back to our traffic ticket analysis and running the stop sign that we first started the program with, this guy effectively had no policemen standing there in the bushes. He's off the hook, and for all of 2013, he will be declared a small group and ineligible for penalties. So whether he covers his people or don't cover them, whether he has appropriate types of coverage, charges them 9.5 or 10.5, he as an employer would not receive a penalty. Let's do another example. This could be, for example, 4 McDonald's, with each McDonald's having 5 full-time managers. It could be a construction firm where they have supervisors moving from site to site and are hiring lots of part-timers each week. In our example, we have 40 part-timers with 24 hours each week. Same ground rules as before, only 4 weeks in this hypothetical month. So we do the analysis again. Number of full-time employees, 20. How many hours are worked by a part-timer in a month? Well, if it's 24 hours per week, 4 weeks per month, we have 96 total hours per part-timer. There's 40 part-timers in this collection of workers, which means we have 3,840 total hours. And if you're doing your math real quickly, you just realize that this company of 20 full-time people is now going to be defined by PPACA as large, because that's 32 full-time equivalent bodies, or in other words, this company has 52. This means this company is eligible for penalties. It doesn't mean they're going to get the penalty, because just like our analogy at the start, they may get pulled over, but there may be reasons why they do not get a penalty. Obviously, you already know if you've attended our other classes that one of the major reasons is perhaps nobody qualifies for a premium tax credit in the exchange. And a large group that has no employee qualified for a premium tax credit cannot be penalized. We'll get back to that discussion a little bit later. We've got a few more rules designed to confuse you, because what we have is two categories that differ. We have a category of how to calculate group size versus a category of how to calculate penalties. So what we have is group size is determined by full-time and part-timers. Full-timers, 30 hours at the rate of 30 hours per week, 130 a month, and part-timers with that equivalency math that we already did, dividing by 120. Seasonal workers do not count for group size. Now let's make sure we're clear on this, because you heard me describe an employer who hired 10 seasonal people last January. And then I said on the 120th day they morphed into full-time, and that sounds like I'm counting part-timers, but it's a definitional trick. Once the person gets to 120 days, he's no longer defined as seasonal. He's defined as full-time, therefore he goes into the account. So what you've got is really a question of semantics. Any employee working at a full-time rate for less than 120 days doesn't have to be counted to count group size. So for example, if I have a very poor hiring department in my HR department and everybody I hire never makes it past the first 90 days of probation, none of those employees would be counted as full-time people because they didn't make the 120 day. But what about these penalties? Well, penalties can apply to full-time and seasonal people. So if I become a large group, and if I have seasonal people working for me who are getting premium tax credits from the exchange, I can be fined for that situation. Likewise, it can be fined for the full-time people. The penalties, though, are going to differ between two situations. One situation is where the employer does not offer health insurance. In that case, the penalty is a $2,000 maximum annual penalty, and it's applied to every employee that's in the company, whether they're covered or not, except for the first 30. So for example, I have a 100-life company. I don't offer any coverage. Even one employee goes to the exchange and gets premium tax credit. My penalty would then be 100 employees minus the first 30 and $2,000 per year for the remaining 70. However, keep in mind the $2,000 a year is a little bit of a misunderstanding. The penalty is actually 1/12 of the $2,000 for every month the penalty condition exists. 1/12 of the $2,000. So a company not offering coverage at the first of the year but deciding to offer coverage halfway through the year, they would not pay $2,000 per employee. They would pay half of that since they were guilty of 6/12 or 1/2 of the time being in the penalty phase. The second penalty that occurs is a $3,000 penalty, and generally this is the one an employer will want. Even though it sounds higher, the $3,000 is applied only to those employees who actually go to the exchange and get a premium tax credit. So if I had a 1,000-man group offered absolutely no coverage, and all of them went to the exchange, and none of them for some reason got premium tax credits, it would typically be $2,000 a year, but in this case, no premium tax credits, no penalty. If I offered insurance to my 1,000 employees, and one of them did not take it, and one of them went to the exchange and got a premium tax credit for some reason, then my penalty would be the $3,000, but just on that one person. So there's different penalties at different times. For more clarification, go back and listen to our prior presentations in this area. Let's get back to the question of whether to count or not to count. You see, if you're a group of 1,000, you really don't have to count because you already know you're a large group. If you're a group of 5 or 10, you don't hire part-time people and seasonal people, not much need to count there either. It's the employers who are right on the edge of that 50, maybe companies as low as 30 lives, maybe companies as high as 65. Depending upon how their work pattern or the workflow during the year, they may find that counting gets them below the 50 or above the 50. So clearly, if we're way under or way over, we really don't need to be counting, except we still need to define certain measurement periods we're going to talk about for our new hires. So even though I'm a 1,000 life company, I know I'm 1,000 life, I'll want to define my counting periods because it will impact how I decide to cover new hires. Keep in mind that penalties will start for a company when their anchor renewal occurs in 2014. Now, you're not going to find the word anchor renewal in the PPACA rulings. We're using that term to try to identify for you a rather complicated way of determining when do penalties start in 2014. Here's what happened. A ruling came out that said if you had a group health plan in place prior to December 27th of 2012, the renewal date in the last 12 months prior to 12/27/2012, that is your renewal date for 2013 and 2014. If you change that renewal date in 2013, your penalties still start at what would have been your original renewal date in 2014. So hypothetically, a company on March 1st, 2012 does its renewal. In March of 2013, it tries to avoid its PPACA penalties by shifting its renewal to November of 2013, thinking it will delay its penalties until November. That will not be the case. The penalties will be calculated as of March 1st, 2014. So that means in changing to a November 2013 renewal, that company better be in compliance with PPACA as of that renewal. Otherwise, it might be very difficult to change a contract in the middle of the year and have to pay the penalties from March till November 2014 when they finally get to change their contract. Keep in mind that this anchor renewal and this delay of the renewal only applies if in 2013 at your regular renewal date you have at least a quarter of your eligibles insured. If you have less than a quarter of your eligibles, you have a carve-out of some kind, then your penalties will start the first day of 2014. As I said, even if you know you are a large group, you're still going to calculate and put down in writing how you're going to count people, because new hires get affected by this definition we're going to cover in the next few minutes. Well, who is full-time? Well, we've already talked about that. And we want to make sure you're aware that this counting process we're talking about in this hour is safe harbored or is good until the end of 2014. That's the safe harbor that the IRS has given us. They may change it, they may keep it the same, we won't know until later in the year. We're going to count the three kinds of employees two different ways. There's three kinds of employees: full-time, variable, and seasonal. We've already talked about that. But the two ways we're going to count them is ongoing and new hires. Here's the analogy I want to use. I'm doing my count on the very last day of 2013, 12/31/2013. My contract renews January 1st, 2014. Now I'm using the last day and the first day of the year to make it simpler to understand. But you can use any two days in 2014. May 31st and June 1st, whatever it may be. If I stand on that counting day of December 31st, 2013, all the employees that I have starting with me that morning, as they transition through that day into the new year, as they kind of cross the line to the new year, all those employees crossing the line are ongoing. Those are the people I have to determine, are they going to be covered or not? Part-timers don't have to be, full-timers do have to be. Obviously, seasonal people that I hired earlier in the year, even if those seasonal people became full-time for the purposes of accounting, if they're not hired when I go between this old year to the new year, they are not an ongoing person. Now, if I rehire them 6 months later, and I intend to make them seasonal at that time, I'm going to handle that a different way, and we'll talk about that. But there's different rules for new hires versus these ongoing people that transition between my old year to my new year. So how am I going to count these ongoing full-time people? Well, I'm going to begin by looking back. As I stand on December 31st, 2013, I'm going to look back over some period of time. For our example, I'm going to look back all 12 months simply to make it easier. However, every employer will select his own method for looking back. He'll select a different date for looking back. He'll select a different time length for looking back, depending upon what he wants to do. Everybody gets a choice. Whatever the count is in 2013, I'm just going to stand in 2014 for the same length of time. So, if I use my group size, that first tells me, am I required to offer coverage? And then, as I do my looking back, it tells me who I'm going to have to offer coverage to. If I do my look back and I'm a small group, all the rules are off. Who I offer coverage to is between me and the carrier and participation requirements and everything else, but not regards to PPACA. So what are the basic concepts? Every employer will pick 3 defining time frames by which he will measure people's activities of work and coverage. The 3 time periods start with something called the standard measurement period, and this is going to be used for all ongoing employees. New hires, that in my example, since it's 12/31/2013, new hires or any of those that start after 1/1/2014, they're going to be measured in something called the initial measurement period, which will look very much like a standard measurement period, but just for that one employee. We're going to define what the standard measurement period is in just a few moments. But remember, standard measurement period is one of the measurement periods by which we're going to look backwards into 2013 to determine our count and who's an ongoing employee requiring coverage. Secondly, we're going to have administrative period. An administrative period is just what it sounds like. It's a period of time in which we do our count, we notify the employees of who's going to be covered, and it's a period that has to straddle between the standard measurement period and the third period called the stability period. Since I'm standing in my hypothetical situation on 12/31, my standard measurement period, my look back, is going to be all 2013. I'm going to use my administration period as 1 day in length as an example. Of course, that's sort of silly. It wouldn't happen that way. My stability period is going to be my period looking forward. In other words, I stand on 12/31, I look into the future of all 2014, and that's going to be my stability period. It's called the stability period because it means the people who come across as ongoing employees, if they get coverage, get their coverage continued. Now, what we don't know at this point is the length of time I pick for my standard measurement period, my administrative period, my stability period. We don't know how long an employer is stuck with that pick because all they've told us is that this process is good through 2014. We'll know more as we approach 2015. So how do we define these 3 periods? First one, the one looking back. Remember, I'm standing on 12/31/2013, and I'm looking backwards in order to count each ongoing employee's work history. That's to determine whether I count him in for group size and whether I count him in for coverage. Ongoing is anybody employed at least the length of my standard measurement period. In this case, since I'm looking back to 12 months, it's anybody the majority of those 12 months. I pick a given date for each category of employee. We'll come back to this in a moment. But basically what it means is I can look back and count people in one category work for a year, another category for 6 months, another category for 3 months. How long I look back is the employer's choice, but it's within certain kinds of limits. Those limits include that they must be consecutive calendar months. So I can look back for 3 months or 6 or 12 or whatever it may be, but it must be consecutive months. Since I'm looking back into 2013, I can't choose the months of May, August, and December as the 3 months I want to count. But I could pick the 3 months of November, October, and September. The number of months I have to pick cannot be less than 3 and cannot be more than 12. You may wonder why such a variation. Well, remember my hypothetical situation? I'm sitting at 12/31. What if in looking back over my work history, I discovered that I had 48 employees January through June? 52 employees, July through December. Well, if you do your math, 48 for half the year, 52 for half the year, I end up with an average group size of 50, and that makes me eligible for PPACA penalties. Instead, I might choose to pick the first 6 months, January through June, and that would mean I get to declare myself as a small group. Unfortunately, my look back of only 6 months means I'm going to have to do another look back period halfway through 2015. So there's some pluses and minuses of not choosing that full 12 months. We'll get back to that in a moment. Remember, I'm counting full-time employees as anybody who worked at the rate of 30 hours a week or at least 120 days a month. And I'm also counting any seasonals who morphed into full-time and any variables to become full-time equivalents. The second category I define is administration period. Now I'm pretending that I'm doing all my administration one day on 12/31/2013. That's not very practical. So the administration period will be variable depending upon each employer. However, what you have to keep in mind is the administration period is an overlap. It doesn't change the length of the standard measurement or the stability period. It's an overlap period. By the way, it says must overlap the prior stability period. The reason the rule is written that way is next year on 12/31/2013, in my hypothetical example, in 12/31/2014, when I look back, I'll be looking back over my prior stability period. See, every prior stability period becomes the standard measurement period when you look back. So that's why they're describing it that way. The administration period cannot be longer than 3 months. So basically it's me 3 months to do all my body count, check all my work records, notify all my ongoing employees who will enroll, who will not enroll, go out, shop my census, perhaps put a new carrier, do all the enrollments, get the case issued, etc., etc. While enrollment occurs during this administration period, it's not the only thing that occurs. Group size defining and also getting our definitions for new hires ready also occurs. Anybody who comes across with us ongoing through my administration period, which in my hypothetical example is 1 day, anybody who goes through as an ongoing employee enters the first day of the new period into something known as stability period. It's called a looking forward period because it's basically saying that this period is the time during which the employer must continue to offer insurance to those ongoing employees even if they had a change of status. This stability period has to have obviously some waiting period for new hires, which in PPACA is a maximum of 90 days, and that may vary from state to state, by the way, so do check your state. But we're going to have some type of stability period for our ongoing and also some type of stability period for our new hires. The stability period must be at least 6 months in length, but must not be any less than the standard measurement period. So you can see the problem there. Standard measurement period could be as short as 3, 4, or 5 months. But if you measure only for 3 or 4 or 5 months, you have any ongoing employees, you must cover them for 6 months because that's the minimum stability period. If your standard measurement period is 12 months, then the stability period is 12 months. 6-month minimum is what the stability period would be. Here's a chart of the ongoing process. In yellow, in this particular example, we took an administrative period that started on November 1st. The yellow chart says looking back at the standard measurement period. That would run, in this case, 12 months, 10/31/2013 to 11/1/2012. I'm going to overlap my administration period between the old standard measurement period and the new, in green, stability period, which is going to start 1/1/2014. I'm using a 90-day enrollment, and of course the rules were that I can use one that long. So during those 90 days, I'd form those who are going to continue getting coverage, those who will pick up new coverage because they've met the requirements, but this does not include any of my new hires. As you can see in green, on 1/1/2014, my new contract starts, And everybody coming across on that day enters a stability period in which they have to be offered coverage. If you look further to the right, next year I'm going to have another administration period of 90 days. Again, I'm going to use a new stability period that will start 1/1/2015. Since I'm using the same stability period as my standard measurement period that I just finished, you can see my admin will overlap my prior stability period, because in purple is the standard measurement period that I'm going to use next year. In this way, this process cycles repeatedly year after year, but like we said, we don't know how many years this process will continue. I said you can have different periods, different standard measurement periods, different administration periods, different stability periods for different kinds of employee categories. Every one of them can be different between categories, but all employees in the same category have to be handled the same. The different categories can vary the periods of time I'm measuring, and can also change as to when I'm doing my counting or when I'm starting and ending my dates. So what are those categories of employees? Well, the categories, collective versus non-collective bargaining units. Obviously, I have a collective bargaining unit that runs from June to June, and I have everybody else on January to January. I need that flexibility. Salary versus hourly. This could particularly come into play for agriculture, for companies with lots of seasonal activity, for fast food restaurants. They might have a very different kind of accounting process for any of those different kinds of employees. Uniquely distinct business entities with common ownership. In a prior course, we talked about what common ownership means, but let's assume I have common ownership with a radio station, a tire repair store, and a beauty parlor. Well, even though I have common ownership, each of those three employer groups could have a different standard measurement, administration, and stability period. And obviously employees in different states. In fact, when we move across state lines, different state regulations may almost mandate that we have different kinds of counting periods. So what would a counting system look like? Well, we've got actual Excel models on our Ward and Brown website that you're more than welcome to take a look at and to use. It's basically set up like a ledger, like an Excel spreadsheet. There would have to be separate months during which we would count each employee during our look-back period, enter them into the month. Since it's only about March of 2013 when we're making this recording, we would want to perhaps start tracking with our Excel spreadsheets immediately. The reason for that is if I had an employer right at the cut mark of 40, 50, 60 number of employees and started tracking hours of variable and full times immediately, I would still have a chance to change my hiring practices for 2013 before the end of the year in order to come in under that magic 50 full-time equivalents. With each employee on my tracking system, I would have to list the hours worked by employee by month. I'd have to identify the full-timers, and I'd have to do a calculation as to how many variable hours turned into a full-time equivalent. I'd also have to be sensitive to the fact that some seasonal employees, as they reach closer and closer to their 90th day of hire during 2013, I may have to make a decision whether I want to let them go or continue them, because the moment they hit that 120th day, they go full-time. What's going to happen with this Excel spreadsheet is to total up all those numbers, very similar to what we did with the simple example at the start of the hour, and to arrive at a monthly number for every month of the year. Then we'll be adding up the number of months we want to do the look back, 3, 6, 9, 10, whatever it may be, and averaging them across the period of time we're looking back. Compensation counts. As I'm counting each person for each hour during each month of the year, if I compensate the person, whether it's for paid vacation, sick days, maternity leave, if that's paid, jury duty, any compensated hour gets recorded. And that adds to the Excel spreadsheet and goes into the full-time equivalency or full-time basis. Again, keep in mind, we want to watch out for those magically morphing employees that we hired as we think seasonal, and they became full-time somewhere in the last 12 months. Because at that 120th day mark, working at a full-time rate, poof, I get another body and can raise the count for my group size. Here's an example of one of our presentations. If you look at the thing, we've included, just for your easy identification, row B. That's the number of seasonal employees that were employed that magically changed into full-time people during the year. Since we know the definition of counting a group does not include seasonal people, technically B isn't seasonal. All we're trying to represent here is that last year in January and February, sometime in there, we had 20 employees morph into full-time people. They may not be the same 20 people all the time. They may not show up in March and April because perhaps they were let go. But all we're trying to represent is the fact that if we have morphing seasonal people, the number of full-times for January would be the 40 and the 20. For February, 40 and 20. November, 40 and 20. December, 40 and 20. The rest of the time, because we had nobody morph into a full-time basis, the top column, column A, the 25, was all that we had. Row C is the total number of hours we've tracked. And as you can see, for our example, we've just had everybody work the same number of hours. D divides by the 120, just as we did in our first example. And as you can see, the average number of employees ranged from 74.7 to 39.7, but across the 12 months, it was 51 employees. In this example, we may be very well served to pick 6 consecutive months in the middle of the year to do our count and get ourselves down to 39.7 in order to stay below the large group definition. Here's a worksheet you can find. It would simply be a way of taking every employee that we're currently working with and tracking the total number of hours. As you can see at the bottom of the chart, the total hours 1761 were the same number of hours that we eventually transferred over into our group calculating slide and divided by the 120. Let's go back and take a look at that. There they are. And it's those total number of part-timers that caused our group to possibly go into large group size. So if we were doing this as of March 1st, 2013, perhaps we want to cut back the part-timers, cut back the seasonals in order to stay underneath the magic 50 full-time equivalents. The next example is an example of a seasonal workshop. The problem with seasonal people is you've got to both track the hours and you've got to track the number of days. If you think about this for a second, if I have 2 employees that I'm working at the rate of 12 hours a day, every 2 days they get 24 hours, but only 2 days worth of credit. If I have 3 employees working 8 hours a day, every 3 days they get the same 24 hours of work credit, but they get 3 seasonal days. Now I recognize the first 2 people would be paid overtime, but either way, the point we're getting at is our seasonal people working at the rate of 8 hours a day, 3 days, will become full-time people 50% quicker than the ones that are working 12 hours a day because of the number of days worked. In the chart that we have on the website, you won't see this automatic counting which is showing up in red on your slide right now. We've done this for your demonstration. You'd have to actually go back and see when did John Doe or Jimmy Smith, whoever it is, morph into a full-time employee. We've identified them here just for the purposes so that you can see which ones morphed. When they morph at whatever date, they morph back to their date of hire, so you have to count them back to the date of hire. Because in reality, when they hit that 20th day, even though you hired them seasonal, the first day they worked, they were really full-time people. You just didn't know it yet. So those full-time people are going to be added into what would be column B. Now in this example, we found 20 of those in our worksheet, just hypothetically. So what about our new hires? I said that these periods of time we're defining affect new hires, and they do. The first thing you have to recognize, once you define your ongoing employees who transfer into your new contract year, Every new hire after that has a employer safe harbor of reasonable expectation. So an employer does not have to cover everybody who he thinks is going to be part-time and he thinks is going to be seasonal. The employer running the ski lift, he hires 10 people on January 2nd. If he has a reasonable belief that those people are going to be seasonal, he does not have to offer them coverage. However, if he continues working with them past that 120th day, at some point he may have to offer them coverage. Likewise, a part-time person could be hired. This could particularly be true in a large company. Part-time people are hired and put perhaps in the accounting department for what they think is just going to be the tax season. Well, it turns out the people running accounting use those part-time people, call them in for more and more and more hours, and at some point those new hire part-times add up enough full-time hours that part-timer magically morphs into a full-time person, and then at some point in the stability period he's going to have to be offered coverage as well. Each variable hour person gets tracked, and each seasonal person gets tracked, and they get tracked in what's known as their own initial measurement period. The initial measurement period is defined in the same way that the standard measurement period is. So if the company has a 12-month standard measurement period, the variable hour part-timer has to be tracked for 12 months in its own unique initial measurement period. At the end of that time, it has to be decided whether he met the criteria for getting coverage, and if he did, he has to be given coverage. So if you use a standard measurement period of 6 months in order to try to reduce the size of your company, 1, you'll be doing the count twice a year, and 2, all your new hires are going to have a 6-month initial measurement period. So you may be putting more people on and carrying them than you intended. The initial measurement period is just like the standard measurement period, and ultimately each of these new hires will convert into the same standard measurement period as the group. So I hire someone midway through 2014, and I do another standard measurement period on 12/31/2014. It's at that point that I can go ahead and measure that new hire to see if he conforms to ongoing employee status along with everybody else. The initial measurement period also has an administration period. The only difference is the administration period for an IMP can only be as long as the last day of the calendar month beginning on or after the first anniversary date on which the person started. So if you think about that, it basically cannot be any longer than a 60-day window. I'll give you an example of what I mean by this in a moment. The stability period requires you to keep recounting the new hires as long as they continue to work for you, and if they come into coverage, then they get their own stability period. So a guy hired on February 1st has an initial measurement period perhaps of 6 months, if that's what my standard measurement period was. That would mean sometime in July I have to do the administration period and count him. If he then qualifies for coverage, he gets his own 6-month stability coverage period on which I then have to cover him. Here's an example of a new hire. We're going to take a look at our new hire, Bob. Bob gets hired perhaps at the 1st of May. His standard measurement period through 2014 and on into 2015 is the 12 months that the company used. At the end of his standard measurement period, he would have his own administration period. In this example, that would be the blacked arrow, and he would have to be offered coverage on June 1st, 2015. Could he have gotten coverage earlier? Yes, because my company did its annual standard measurement period on 12/31/2014. If Bob had qualified at that time, he could have been brought in as an ongoing employee, and I would no longer have to track him separately. But if on 12/31/2014 he didn't qualify, I still have to continue tracking him until he reaches his 1-year mark for his own individual measurement period, initial measurement period. By the way, how long would Bob's stability period be? Well, in this example, his coverage starts June 1st, 2015, so his stability period would run until May 31st, 2016. Unless, of course, on 12/31/2015, when once again I did my company standard measurement period, I could bring him into the ongoing status. So what do we conclude out of this last hour? Well, get ready for 2014. Given that this program was being recorded March 1st, 2013, recognize that some of the rules and regulations may have changed. You'll want to go back and pick up any new material that we might cover after that date. But as it stands now, we probably want to get out there and talk with any of the companies we know have a possibility of ending up as a large group. We want to go back and look at the look-back periods, determine how many full and part-time equivalents go into that group size, because we still have time to change our hiring and our work hours during 2013 to effectively, legally, get our group back down under that 50 full-time equivalent. Keep in mind, on the last day of 2013, I can get that count under 50 full-time equivalents with a 12-month look back. That means I get to stay that way for 2014. That's very handy. Period, your administration period, and your stability period. All those choices affect how you count, whether you're a larger group, and how new hires are going to be treated as you move along. And obviously, there's going to be a lot of dependence on good faith interpretation of how you're doing these counts. Don't forget your 5 or 5%, whichever is greater, safe harbor. And also don't forget that you have to have good faith in doing as accurate a count as you possibly can. It's very complex, so do stay with us and come back and visit Ward and Brown throughout 2013 as more of these regulations get clarification. We'll look forward to having all of you listen to us again then. Thanks for your attendance.